mitä yhteistyössä nyt sitten on ajateltu silloin.
Joo, jos 20 ääntä tiedossa.
Morning.
Good morning.
Oliko tämä aika? All right. Welcome to the demos of Helsinki Hackathon Challenge. Our jury is present, and I show the lines there. We have Leena Turpeinen, Director of Health and Substance Abuse Services, Mika Perttu, Chief Digital Physician, and Petri Otranen, Chief Information Officer. Each presenter have 4 minutes, and that's strict. Kaisa will help keep the time, and I will give the Mikael, you will running.
I'll also have the first presentation. You can start the clock. Meillä on siis terveystiedon talteenpalvelu, joka on hyvin yksinkertainen, antaa potilaan ladata omat tietonsa itselleen tiedostoksi ja sen jälkeen käyttää niitä itse haluamallaan. Tämä on ollut Jenkkilässä arkipäivää ja pitkään siellä sovellukset pääsee kävisi potilastietoihin. Yli 85% sairaaloista tämä on käytössä. Esimerkiksi siellä Apple-helptiin voit saada kaikki terveystietosi. Tai Android-puolella Common Health tekee vastaavaa. Sitten se tulee esimerkiksi Androidissa Health Connectiin pääset katsomaan sinne, joka kaikenlaisia sovelluksia, joita terveyshuolto on yksi kategoria. Ja yksi sieltä pääsee katsomaan vaikka rokotukset ja pääsee jopa ihan tuonne ison tasolle, eli sen data tulee sinne ja tätä pystyy myös sieltä jakamaan eteenpäin muille sovelluksille. Ihan viime aikoina tästä on tullut entistä relevantimpaa, koska OpenAI avasi ChatGPT Healthy, joka on siis tekoäly nimenomaan sinun henkilökohtaiselle terveydelle. Ja siellä on kaikenlaisia eri rajoitteita, että ei tämä data ei vuoda muualle ja tämä ei saastu muualle. Nimenomaan tämä itse potilaan keskustelevan terveydestä tekoälyn kanssa. Samanlainen Anthropicin Claude. Tämä on tulossa, tähän kannattaa varautua. Ja tämä toimii paremmin ja kätevämmin silloin, että oikeasti on rakenteista. Sen lisäksi tämä meidän simppelipalvelu mahdollistaa satoja muita käyttötapauksia. Tämä vain vapauttaa sen tiedon siihen, että potilaat itse pääsee käyttämään sitä rakenteisessa muodossa. Miksi tämä tulisi tehdä? Ennen kaikkea siksi, että tämä on oikea asia tehdä. Potilailla pitäisi olla pääsy siihen omaan datansa ja ei pitäisi olla mahdollisuus potilaille käyttää niitä. Haasteisiin hyödyt, se voimaannuttaa potilasta ja tämä mahdollistaa tosi monta muuta use casea, kun tehdään tähän. Me ollaan todistettu, että tämä toimii Epicin kanssa. Tästä ei tule edes kustannuksia eikä muuta. Oikeasti tarvitaan vain viesti Epicille, että hei, avataan nämä rajapinnat ja sen jälkeen tämän kaltaisia sovelluksia voi ottaa käyttöön. Voidaan joko ihan kaikille tai sitten sanoa, että apotti lataa kunkin hyväksytyn sovellus ID sinne apottiin sen jälkeen, että tämä toimii ihan käytössä. Tämän palvelun käyttö on helppoa. Voitte mennä apotti.talteen.fi kokeilla itse Epicin kehitys ja taatikossa, mikä se käyttökokemus on. Ja engagement, kuinka usein tätä käytetään, no se varmaan riippuu omista tarpeista, kuinka usein on tarvetta keskustella tekoälyn kanssa. Tämä ei ole niin varsinainen behavior change app, jolla tarkoitus on motivoida ihmisiä tekemään jotain, varsinkin kun heillä on tarpeita. He voivat käyttää tätä sovellusta hakeakseen. Kiitos. Next up. Outbound from remote.
Joo, me ollaan etänä, jos kuuluuko ääneni?
Kuuluu.
Joo, no mä jään nopeasti vielä näytön, niin tehtiin tämmönen nopea video ja sen kautta ajattelin esittää. Kerron ensin vähän Outboundista, niin me ollaan siis suomalainen Tampereesta Eudy-Walletin päällä rakennetaan semmoisia ratkaisuja ja tehdään sen kautta niin kuin verifikaatio, credential issuance YMS. Ja tällä hetkellä keskitytään vaisasti tuohon verifikointiin ja tämä on meidän niin kuin Hackathon-projektina ollut tämä video, tai niin kuin oli appi ja kaikki on valmiina ja mä näytän tää videossa ja tää kaikki. Niin mä puhun tää videon päälle, niin sitten mä selitän sitä paremmin itsekin koko ajan teille. Ensinnäkin, no tässä on meidän niinku Outbound-appi, mitä me käytetään niinku credentialien hallinnanpidossa YMS. Ja mitä me tehtiin, oli semmoinen uusi kohta Health-osioon, tehtiin uusi Health-osio. Ja tästä pystyy silleen helposti importtamaan tietoja vaikka kuten kannasta tai maisasta. Kanta ei ole vielä integroitu, mutta maisassa toimii. Ja sitten joo, kirjautuu tähän maisaan, tämän MyChart tällä hetkellä, kun me ei saatu Apotista oikeuksia vielä tuohon maisaan, mutta ja sitten ne credentialit tulee suoraan niin tähän sun wallettiin, ne on pysyviä. Ja sitten sä pystyt jopa niin kuin, myös synkkaamaan ne niin kuin tässä. Ja tässä niin kuin näkyy kaikki credential-info, eli medikaatiot, no allergiat. Okei, no tällä hetkellä mä huomasin, että tässä on kuitenkin proseduurit, mitä on tehty, tai kuvantamishommat. Jos ne laittaa medikaatio, mutta se on vähän varmaan jäänyt, kun no, viimeksi Lassi puski tätä 5 yöllä, niin saattaa olla se, että se unohtui vähän tuo. Mutta joo, eli tähän tulee medikaatiot, allergiat, YMS, kaikki tulisi niin tähän näkyviin. Ja sitten Selective Non-Disclosurein avulla voi jakaa sitä tiettyä asiaa, ei tarvitse koko hommaa lähettää. Ja esim. Voi kertoa, että tämä on allergia ja ei tarvitse mitään muuta lähettää Eudy-Walletin kautta. Ja sitten mitä se tekee, kun klikkaa sitä exporttia, niin se lähettää meidän appiin, joka on nyt varsinaisesti liittyy tähän Helsinki Hackathoniin. Ja se appissa me hyödynnetään tätä kaikkia informaatiota, mitä me saadaan. Esim. Generoi AI-summarin sillä potilasta, esim. Mitä sillä on, YMS, kaikki tiedot. Ja sitten kertoo nopeasti se key highlight, se ongelmat. Ja sitten sulla on niinku oma AI-kompanio, joka kertoo sille vinkkejä sulle, että mitä sun kannattaisi tehdä YMS. Tässä näkyy niinku nopeasti, että mikä tämä niinku, sen kaikki lablatulokset YMS näkyy helposti visualisointina. Ja sitten täällä on patient goals, henkilön omaa tekemät, maisesta voi importtaa. Ja klikkaamalla AI coachia sä pystyt nopeasti niinku checklistaa, tai AI coach tekee sulle semmoinen checklistin, jossa sä voit niinku katsoa, mikä on tämän päivän niinku to-do't, että niinku, AI coach tekee niinku sun goalsien kautta sitä. Eli ja sen kautta pystyy yliviivamaan ne. Ja täällä näkee upcoming appointments homma, että onko tulevia käyntejä YMS. Ja sitten tässä on semmoinen, että sä pystyt puhumaan AI:n kanssa, oman AI-kompanion kanssa. Ja sä pystyt kysymään kysymyksiä, ja se yleensä kysyy sulta niinku kysymyksiä, mitä kuuluu, mitä menee, mitä oot mieltä, että mitä nyt terveydessä voi YMS. Ja sen kautta yritetään auttaa potilasta sille, että se pystyy hyödyntämään niinku täysin omia tietoja. Mitä me ollaan tehty tähän taustalle on se, että semmoinen ihan oma kontekstiikkuna sen kaikki maisetiedon avulla ja käytetään siis ihan kokonaan sitä potilaan omia tietoja tähän chattiin.
And time. That's your 4 minutes. Thank you.
Kiitos.
Yeah, thank you. Kiitos.
It's got 3 minutes.
Do the same, so
No, you need to
okay.
turn to Teams.
Yes. So if I'm speaking, it doesn't.
So you need to mute. There's some other computer not on mute. That's right. Okay, then use this audio.
Okay, yes. Here and explaining on top of it what's happening. So here we have a web page which allows you to take international patient summary bundle and get it as a digital credential to your digital wallet. So it just turns the information into a document that is digitally signed, and by scanning that QR code, you can get it into your wallet. And it has some example data. You can get these IPS documents from various places, so you can just replace that information and get a credential by filling in the form and pressing get credential. You get the QR code that you can scan and you can get it in your wallet. So that's my digital, my phone on the right side. There's also Epic integration. So if this information exists in, for example, Apotti, then you can log in there, just accept the consent screen with which information you want these IPS documents to have, and then the QR code is again presented to you, and you can get it to your phone. So here I'm using 3 example persons in the Epic sandbox, and all of those 3 people now get their IPS documents in their wallet. So this could be just one person getting different IPS documents from different healthcare providers, from different incidents and so on, or there can be different people having their documents. And now, if we look at the credentials, let's take this release credential here. So in under 3 minutes, I have gotten all these 5 digital IPS credentials in my wallet. So it's really fast and easy for the user to use. It doesn't need many extra steps, just accepting the consent screen, consenting that, okay, I want to have this information from Epic to my wallet, and then accepting the credential offer. And so, for example, here, the person has some medication and lots of information about their different kind of conditions. And for some people, it could be just that there is a higher risk for coronary artery disease or something like that. Some could have their vaccinations as a you don't need a separate vaccination credential or app. You could have it also here. And for some people, it has the allergies and immunizations and allergies to medication. So that's something that is pretty common, that if you have a seizure, if you get into the accident abroad, for example, or in a place where the first response unit doesn't have the access to your healthcare records, they can ask you whether you have medications or allergies or something like that. But it's much easier if you can display it on your phone because it speaks the correct Latin, or it's expressed in medical terms that the emergency care response unit can understand, and they can see that, okay, this is actually being verified by this institution or healthcare provider. So the benefits of this solution is the data is already available, so you don't need to provide any new data. Apoptimizer should also already have lots of these IPS information, and it's easy to implement and have the potential to save lives. Thank you.
Hoitaa oma mikki päällä ja muutelle muuten.
Testing. Testing again.
No.
Unmute.
Then use this mute.
Okay, I'll try to go just in English, no videos. So the idea is to provide MISA companion app, MISA Prevention, powered by this Velmo Shell application platform. And this application would be launched from MISA with Smart and Fire, and then of course there would be links back to MISA. And the point of this kind of engagement platform, what Velmo is providing, is to be able to provide new innovations, engagement for the end users. And innovation examples are face scans, different kind of cardio signal applications, AI, and so forth. And the effective prevention requires high degree of personalization and engagement from the end users, which then requires a flexibility, configurability from the service and access to the native smartphone device sensors. So it's not possible to just do an embedded web service on top of something else. And this is what the platform provides. And here we can have an example now created for this hackathon with a quick application running in mobile device. So this could be branded for MISA. Now it's branded like this. And to show the super easy possibilities to integrate and expand now this medical history from Epic item here, when I click it, we can see that the information is now fetched for this specific end user from Epic database. And the platform also has integrations to Omalo, Kanta, and so forth. And there can be third-party applications or embedding done by either City of Helsinki or by different third parties. And the embedding third-party services can be embedded like web services, or the platform also allows a possibility to build your own components. And on the left-hand side here, we have a configuration tool. So everything is configured. That makes it fast, cheap to make your service. That's the benefit. And it's super easy just to drag and drop here stuff and publish. And you will immediately see what's going on here in the device. So for example, here is now set data for this example user for the last 7 days created by a component. And when the sort of components that we have are run out of and you need something more, then you can actually build your own components with Vue.js, React, and just import those to the platform. And we provide those tools to build those components. We use them ourselves. So those would be first-class citizens on top of this platform. How much more time I have? 1 minute. Okay, I was faster than I thought. And as said, the sort of integrability has been what we have been thinking about here. So the platform provides also Smart on Fire as an identity provider, OpenID Connect as an identity provider, different kind of mechanisms, so that exactly those different kind of third-party services are easy, fast to embed on top of this platform. And this platform is in use by different kind of insurance companies and providing services to their customers already. So it's an existing service. Thank you.
Then it's me again, don't be confused. So SensorTrend also does a diabetes dashboard, and we collect data from dozens of medical devices and hundreds of wellness trackers, and we combine that into views that we help patients understand what things affect their glucose levels and learn from the data, and also facilitate sharing that data. We have also been involved in creating an international specification for continuous glucose monitor data and how to integrate that to electronic health record systems. And this is where I challenge the challenge a bit. So I claim that it's really easy also to push certain kind of data to Epic and Apex. So if you're looking for really easy solutions, I would say ours is one that pushes the boundaries here. We can actually push glucose data and this well-being data to Epic. We know how to do it with Epic and Apotti with Apotti for 10 years already, and we've shown this in several instances. We can do that. So what this enables is true digital care paths. If you have access to patients' real-time data, then you can export some really knowledgeable people with type 1 diabetes to fully digitalized care paths where they take care of themselves. And then when you notice that the results are deteriorating, then you invite them to visit. And yes, this is really implementable right now, and it's available free of charge, sponsored by Ministry of Health through this digital OK that's currently going on. And we know that there's another platform, Blueco, currently being implemented in Apotti, so let us help there. We have the expertise, we know how to get the data. It's really easy to set up. You only once make the connections, and after that, all the data flows automatically in the background. And we people with type 1 diabetes, we don't really need apps to get us more engaged in our treatment. We need to treat ourselves multiple decisions daily. Thank you. Next up, Lakko, and Lakko is remote. Arto.
Yes, hello all. I'm sorry, I have a 1-month-old child in my lap, but I have prepared a 5-minute video. That is the easiest way to present my case. It's on my website. Can I share the link to this chat from here? So is it somehow easiest way?
We need to check whether we can make that happen. So let's move you to the end of the queue and let's go through
please.
Other demos first.
Yes.
So
Yes, thanks. I will prepare the link.
Hey, buddy. Hey, baby.
And then we can just share through
Teams.
Teams. I'm sorry, I thought I had a couple of more minutes, but that was not the case.
Brain informed, are you ready?
Yeah.
Oh, thank you.
Mike.
Actually,
Oh, so I'll just share my screen, right?
correct.
So hi everyone, we are Team Brain Informed. We are a research business project from Aalto University, and eventually we are looking to spin off into our own company. And we're trying to make a giant leap in stroke rehabilitation by introducing neurophysiological biomarkers in the stroke rehabilitation planning. And during this time we've been working on this, we've been very actively involved in the current rehabilitation processes. And what we have learned is even without our scientific approach, there's so much to improve on the rehabilitation workflows and how they work currently. And for the sake of this hackathon and 24 hours that we used to create this demo is to show that we know that relatives want to be really involved, especially when it comes to older patients in stroke rehab and also in rehabilitation in more general. So what we created is a smart app in the MISA, which is basically presents the current rehabilitation plan and the next best action, so that we can actually to involve the family members better in supporting the rehab process. The benefits, of course, are we can enable a low friction access to your daily rehab plan for you and your family members. Because in rehab, it's all about friction. Like the easier it is, the easier, the more likely you're about to do it. Super easy to use, and we are going to present data that's in a lot better form than it is currently there. And it's also quite easy to implement because the data that is needed already is in Apothe. I'm going to show you that in the end. And regarding the engagement, when you're interacting with the smart app, we collect data into our own database inside the app, which enables us to create notifications and example, if you are meet your rehabilitation sessions or just motivational messages in general. And now I'm going to show you how it actually looks like. So let's go think about that. For example, my mother has fallen on ice and now she has a rehab plan. So here, so I opened the smart app in MISA as a family member, and then I already have the rehab plan made by the therapist there. And then I'm gonna, for example, let's do the reps. I'm gonna help her. Then we'll go to the next. Okay, I haven't seen this exercise before. So, but yeah, when I click the exercise, here's the instructions how to do it. And we have even a video embedded there. So everything that is needed for you to support your loved one to do the exercises are there. And if there's something that she's feeling bad or something, she can't do some exercises, I'll just skip it and we'll store the information. And we're going to have the history here as well, which enables us to create those notifications, but also give yourself a graph of what you have been doing. So the smart app is basically there. And then, I just wanted to highlight that in terms of implementability, all the data that we need is already exists at a pre-text field in the clinical notes API endpoint. So we can parse the information there, put it in our database and link it with keywords into these videos that are already actually used by you through physio tools. And then when we have all the data in the database, we create the interactive data with the app and be able to do the notifications. Thank you. That's all.
Yes, hey, Bobby. Let's see, share content and Let's do screen. That'll be great. Okay, so my baseline is a simple idea of an application that helps with memory, because memory is volatile. The recall, it degrades severely. As the windows grow, we have a bias based on how am I feeling now. It's hard to remember how was I feeling 2 weeks ago. How was I feeling when I swapped out the right medication? And daily diaries, they reduce this bias, and the point is to support patients in telling their story properly once they come to the doctor. The first use case is exchange of medication based on generics, which is something we do very frequently here in the Scandinavian countries. This would initiate a schedule of check-ins that will pop up as forms to a push notification, and whether this is an app on its own or a part of an existing app is not really relevant. The point is either the patient will need to say, okay, they swapped my hypertonic medication out for another, or this is an event we get from Apopti. I do not know if they supply those events. I am sorry. Simple answers. The patient wants to give a very general, how am I feeling, with an option to add details. For other schedules, there might be a specific question, but the whole point here is to have as simple and low effort answer as possible from a patient's perspective that they can then show to the doctor during the visit, or in the best case scenario, we can actually post to the EHR as observation so that a physician can preemptively contact the patient if something is wrong. That is all, actually. Very simple.
Do I turn my mic on? It's fine. All right. All right. So imagine retiring after a long, successful career. Slowly, your hearing starts to degrade. You stop going to social occasions. You can't even talk to your family on the phone. Your world shrinks. Now, this is something that happens to every single one of us as we age. I'm sure you can all think of someone right now who's going through this. As it turns out, 80% of people with hearing loss don't even have a diagnosis for their hearing loss. And this has now been realized as the number one modifiable risk factor for cognitive decline. It affects us all as we age. Like wrinkles, it's just a matter of time. And it's projected to be 1 in 4 people by 2050. So there are solutions available. This is not a technology problem, it's a workflow problem. People just don't know where to go for help. So the current pathway through all those points is quite convoluted, but let's imagine that it could be just drastically simplified and made really easy and accessible. So we are building the application that would allow anybody to book an appointment for a hearing test. Right now, you actually don't need to go through primary care. But what we'd like to do is have patients fill in the questionnaire before the clinical questionnaire before they go for their appointments. And this is going to drastically help the clinical staff triage the patient correctly. You go in for your hearing test, you have your ears imaged. Now, looking into the ears is a really important part of the hearing test. So we have also developed some technology to make this entire process really simple, that someone without clinical experience can get really high quality images of the ears. And we do the hearing test following that. So all this could be done in primary care without the current months and months of queues and sometimes years of queues. And once everything is done, your results are going to be easily available also on MISA for you to review with the assessment that the doctor has for you. Now, this is a global problem, and we're happy that we'd be able to integrate this into Epic on Apathy because we are going with the FDA into the US market first. And that's where we're starting. So a medical grade hearing assessment that can be done by a medical assistant in less time. Results are easy and clear. And then we also will be providing later on a simulation to allow patients to experience the benefit of hearing amplification, and also do cognitive testing. So we're building the O-Screen platform. Right now, we have some components of it, and this is a future product we're going to be releasing next year. So doctors will have a clear snapshot of their patient's hearing health. It's no longer going to be guesswork. It's not going to be something that's hidden in the background. It's going to be as common as having your eyes checked. And of course, social engagement and mental health is going to be improved. So hearing is the new vision. So let's take care of our hearing, use it, don't lose it. Thank you.
And a third entry from Sensor Trend, building on the two previous ones. So I said the remote monitoring for diabetes is an enabler for this kind of care paths. And we have the digital care plans for diabetes. So this takes the established best practices and treatment protocols, käyntähoitosuositus for diabetes, and formalizes that into an app. So I, as a patient, get better visibility of what I'm kind of entitled to, what kind of care, and also for healthcare, this gives visibility on treatment gaps, which is the population that's been treated well and which not. And this is engaging every month. It tells me, hey, Mikael, based on your numbers, seems that everything's going fine. If that's the case, keep doing what you're doing. You have slide on that. So you get these kind of messages. If everything's fine, I just keep doing what I'm doing. But if I feel that now it's time for me to go back to human touch, I can just simply respond to a message and say, now I'd like to book an appointment. But with this kind of service, I can be outsourced to a digital care plan for months, years, and so on. We do have the paid practitioner view, so it's mobile app, but also the healthcare professionals see it. And what we'd like to use the MICE integration for is currently filling in all of the essential information takes a lot of manual effort. So we'd like to read that information from MICE, and we can use the patient-facing APIs for that. So let's just open the patient-facing APIs to make these kind of apps available. Again, the care plan empowers the patient and also gives feedback to the healthcare system, which patients have been treated according to protocol, which not. Where's the biggest gap? And implementability, we've been working with Apotty for 10 years already, so we know how to make this happen again. And ease of use, this has been developed by people with diabetes for people with diabetes. We know their needs. We also know the needs of clinicians in this area. And engagement, again, this is not a behavior change app, so it's not meant to bug you each day, hey, do this, but it gives you alarms, hey, your next checkup is in 3 days, or whatever you set your preferences to, and it gives you access to your care plan and empowers you there. Thank you. And I guess we have one more from Arto. Let's try to play it from this computer. So. Oh, Metabyte is also here. Metabyte, you go first.
Sure. Hey, good morning, everyone. Thank you. So I will share my screen, which, can you see it now? I see no hands or thumbs and hear nothing. You can, okay, awesome, great. Thank you all for the previous presentations, very exciting to see them. So what we do at Metabyte, we offer a AI-based nutrition coaching platform, and we have both automated solutions as well as AI-assisted solutions that healthcare professionals can use. We've been using or working with HOS for a number of years now, and so we have a Fire integration. There's a smart app launch that's in there, and the reason why we exist is to help combat chronic diseases, which drive up to 90% of healthcare costs in the Western world, and we can attribute about half of that to nutrition-related conditions. So what we do is we work with both private and public organizations, mainly in Europe and in the US, although we have worked in Asia as well. And this has given us a unique set of longitudinal data sets where they range from different patient groups all the way to professional athletes. And so we don't have any particular condition that we focus on. We focus on nutrition as a whole. And this allows us to build advanced dynamic profiles based on the nutrition profiles that we can identify with the user population, and then also the interactions if they work with a coach, as well as in a peer support group, and also other data they upload. So this leads us to one of the benefits that City of Helsinki could gain from this. They actually have used the platform in its previous form, Meal Logger, for nutrition coaching, but the automated solution is a really easy way to take it into use, especially because there are existing configurations and integrations that can be applied, which means that it's very fast and straightforward. We don't need to read or write anything on the back end unless they want their coaches to retain data, but that's not necessary. The way it works for the end user, and this is an example from HOS, is they can have programs. This is the HOS $500 program that's in there. But so basically they can interact with different programs that can be from the city or they can be from us. There's a trained language model that we customize for our clients. And there was an example from ChatGPT Health. What we do here is we help customize the answers based on what the client wants, and we have a multi-tenancy structure where we can then customize the whole experience, and that includes testing the language model with over 1,000 questions and making sure that it answers in the right way. So it essentially is a way for the City of Helsinki to ensure that their citizens can get the kind of answers to nutrition-related questions that they think are appropriate. So we basically help them in ensuring that. Very easy to use. We, for example, just with the HOS pilot on these new AI features, got a satisfaction rating in the MVP pilot of 3 out of 4. Our net promoter score for our engagements in the US is 76, and our engagement is around 2 sessions a day, 5 minutes a session, so a total of 10 minutes. And what you can see here is another version of this. So same app, just a different user environment. And so again, it can be easily customized for the City of Helsinki, easily taken into use, and very easy for the end users to apply. And the professionals can use it as well. That's us in a nutshell. Thank you.
Thank you, Metabyte. And Arto, I didn't find a good way of sharing your video with the audio without getting it to be distorted here. So are you able to share your video from your end?
Let's try. Wait a moment. Wait a moment. Do this that and can you say? And I will start the video and to how to share it then. So I have to share video. No. Share the screen. Yes, can you see now?
We do see it, but we do see it from your mobile, so it's in portrait mode if you now see it in landscape.
Okay, there should be sound also.
That's good.
And I start. I press play, but nothing happens.
I think it started playing.
Let's wait.
Now press again.
It doesn't start. Well, I can start speaking. So I'm an inventor. I have this kind of a invention about lakko, measuring lactate physiology from a human and combining it to the air quality measurements. So this kind of a holistic approach for in addition to the hard medicine. So the main use cases I have been thinking are this kind of a sleep disorders, the CPAP or the asthma. So people can have medical treatments for CPAP or asthma, but the treatments are not effective. So this is the problem, because there might be the air quality in the bedroom, inside the house, it's poor. There is too much carbon dioxide or VOCs, this kind of small particles. So the air quality affects to the patients, and the doctors are helpless about that they don't know that why does the CPAP therapy does not work. So I have made a device which combines the physiology measurements and also the air quality measurements, and this kind of a wrist device. And I have a utility patent in the Finnish system now for this, and I am using the prototypes and beginning to find collaborators and customers. And this hackathon is very nice possibility to collaborate and spread this my invention forward. And very nice this clinical decision hooks also, that the doctors could get this kind of a background information from the patient, that why is the hard medical treatment not working. So this also can be carried outside, of course, when you are doing exercise, sport things, wherever. Also outside, the air quality might be poor. But mainly at the moment, I have been thinking that this is mostly for the night use. So we can see how healthy the environment for the patient is. And I'm looking forward where we can go for this together. So that's all for now. Thank you for your time.
Thank you, Arta. And that concludes our series of presentations. Dear jury, if you have any burning questions, if anything was unclear that you'd like to get clarified. If not, then we thank all the presenters. Well done. And dear jury, there are kind of your people on the floor for the rest of the day. So if you need some kind of additional information, any kind of validation, reach out to City of Helsinki people here, so Tero and Jyrki. Thank you, everybody. Well done.
Thank you.